My name is Dr. Michael A. Goldfarb. At the end of February, I had a left total knee arthroplasty or replacement. Well, the first signs really were a lot of pain just walking. I couldn't walk 500 feet and without pain, and that just isn't consistent with living a normal life. And so that was when I first saw him. So before the surgery, I needed a cane to get around. It was difficult to get off the toilet. I couldn't put on my socks. I had pain even sitting, as I'm sitting right now. And so there was a lot of difficulty. So prior to the surgery, I had a series of injections. And those started not working so well. Then I had another long-lasting steroid called Zilretta to both knees, a series of those. And again, I was getting minimal benefit. And basically, Dr. Chalnick said, well, you'll know when enough is enough. And so enough was enough. Flipped the coin, decided to do the left one first. Well, the decision to have surgery was that I simply couldn't continue with this disability, as well as difficulty even sitting. I do some surgery on a part-time basis, and I had to sit with difficulty. I couldn't really walk around. I couldn't play golf. It wasn't a happy frame of mind at that point. As far as Dr. Chalnick goes, he did my right total hip in 2016. So I knew him well, and I knew him even better because I was chief of surgery at Monmouth for 14 years, and I actually watched him operate on some occasions. I knew about his outcomes, which were really special. He's known as a surgeon's surgeon, so I knew that he's very, very careful, very meticulous. I knew his results, I knew his outcomes. Well, now I feel very well. I healed quickly without any kind of infection, and that's what it's supposed to be. It was no swelling, there was no blood loss, essential blood loss. There's always a certain amount of blood loss, but nothing that required transfusion or medication or anything like that. And I really say that by the way, he follows the same routine for every patient. He has a very strict routine. I'm really able to do a lot more than I could before. I was really in bad shape with a cane. And so I feel much better about it. I do have some advice which I think is very important, and that is something called prehab, where you prepare yourself for the surgery. And you do that, you have to do it for about 2 months. And what does it mean specifically for the knees? It means, and I'll demonstrate it literally, being able to lift yourself like that, you know, and having that strength. That's not so easy. That really helps in the immediate post-op period, getting off the toilet and getting off the bed. And I would stress that. Well, Dr. Chalnick has done literally thousands of these operations, hips and knees. And he at this point, he really is a master surgeon, what we would call a master surgeon. And that he is not only able to do these operations efficiently, but he has terrific outcomes. Outcomes being a very, very low failure rate of any sort or infection. And that's key, because if you have a complication after this operation It's a big deal. I'd like to also take this opportunity to thank him. The rest of his group is terrific. They have a lot of very good surgeons in this group. I don't know them as well. Some of them were actually my first year residents when I was chairman. So I do know some of them, but I know Dr. Chalnick obviously in a much more profound way.